Pediatric Cardiac Surgery in Kraków. This is a Pediatric Cardiac Surgery department in the Polish-American Institute of Pediatrics, Jagiellonian University in Kraków. We offer the full spectrum of the congenital heart defects operated upon in this hospital, in this department. Our specialty is multi-stage treatment of the single ventricle heart, especially hypoplastic left heart syndrome. We operate in our institution about 40 cases of this defect a year. Full number children operated upon for the congenital heart defects is over 400 cases every year. And we are proud of our results. What is important that we try to prepare this year very modern new hybrid operating room, hybrid operating theater, especially for the multi-stage operations of the single ventricle heart.
Children's Heart Center in Zabrze is a clinic performing full range of procedures, including the most complex operations in children and neonates. This is the only center in Poland carrying a pediatric heart transplant program. So far we have done 76 heart transplantations. We are also one of 3 centers performing cardiac support program for children in Poland. Until that moment we introduced cardiac support in 8 children, of which 6 received heart transplants. Currently in our center there are 2 children assisted by artificial heart. These are little children. One of them is 7 months and the second 1 year old, and they are currently waiting for heart transplant. The average waiting time for a heart transplant of such children is from 3 to 6 months. The heart transplant program is the only way to keep them alive. Heart support with artificial ventricles is the only way to prolong their life until receiving a heart transplant from a donor.
Our clinic of pediatric cardiac surgery is located in Łódź. Our hospital is unique because we have department of gynecology and obstetrics, and patients are born in hospital. We perform about 450 operations a year. Half of our patients are neonates and about 25 to 30% are newborns. We do all kinds of operations till now except heart transplantations. All complicated congenital heart malformations are corrected in our department. Now we are building a new department of cardiac surgery. In the new department we will have 2 operating rooms. In one of those rooms are hybrid with angio. So we expect to operate more patients. Till now we have big group of patients who are waiting for operations. It's about 200 patients. Most of those patients are patients with single ventricles. So we need to develop new department to perform much more operations because our patients are waiting for it.
The Department of Congenital Heart Surgery at the Children's Memorial Health Institute in Warsaw has the biggest program of the treatment of congenital heart malformations and diseases in children in Poland. We perform almost 500 operations in children with congenital heart disease every year, and 50% of these children are infants under 1 year of age. 25%, every fourth patient that we operated on, is the neonate in the first month of life. 30% of all operations performed by our team are reoperations, especially in children with univentricular hearts who undergo the repair in the 3 stages. At the moment, 2 boys with a severe post-infection heart failure are supported with left ventricle assist device, Berlin heart, and awaiting heart transplantation. One of them spent already with us almost 16 months. The other one had implanted left ventricle assist device in January this year. The other very important patient is a little 4 years old girl, Lenka, who spent with us 7 months, supported by left ventricle assist device, and who finally we managed to wean from this support, and at the moment she is back home and in the very good shape. Children with functionally single ventricle make almost 30% of all our patients. Norwood procedure is the second most frequent operation performed in the neonates with congenital heart malformations in Poland.
3 years ago, we built in Anin the very modern hybrid room. And I think this is the future of the cooperation between the cardiologists and the cardiac surgeons. I think more and more operation, for instance, like a stent implantation, thoracic aortic stent implantation, and some other procedures could be done in this kind of a room. And we were having this room, one of the first in the country. I think this is a must now, and I believe that in many places in Poland, the hybrid room is just a very important part of the daily work. We are growing in Anin in terms of performing more and more procedures in young adults with the congenital heart diseases, and we do have the expert team here, very well prepared, well trained to perform this, and every week we do the 5-6 interventional procedures for the patient with congenital heart defects, mostly like atrial septal defects or valvular heart diseases. I think that interventional cardiology is flourishing, and particularly in the treatment of congenital heart diseases, it is becoming not a competitor for cardiac surgeons, but just to be working together with the cardiac surgeons. We, interventional cardiologists, at least in Anin, we have a wonderful cooperation between those two groups, and that's why we can be one of the leading centers in the treatment of young people with a congenital heart disease and adults with a congenital heart disease. We are at the Institute of Cardiology in Anin referring center for the youngsters and young adults with a congenital heart disease who needs a treatment and who are not anymore under the care of pediatric cardiologists. We were the first to introduce the valve and the pericardial patch closure of the valvulotomy, not only within the conduit, but also with when the surgical treatment was with pericardial patch or Dacron patch, and then we can treat those patients now, introducing interventionally, percutaneously, non-surgically the valve, so it can save the patient another second or third or fourth operation. Polish pediatric surgery, cardiac surgery, and Polish pediatric cardiology is very well developed. They saved the lives of many children, and they are growing up, and they became teenagers, and they became the young adults, and then they might need another operation because the congenital heart defects is a very complex disease.
Percutaneous treatment of children with congenital heart diseases is widely accepted all over the world. And here in the cath lab in the Children's Memorial Health Institute in Warsaw, we are doing it for years. Here we are just the most active center in Poland. During the year, we perform more than 250 therapeutic procedures in children from the age of first day of life. At the same time, we have cooperation with Medical Academy of Warsaw in the field of the prenatal treatment of cardiac defects. 50% of our patients are patients below the first year of life, and half of them are patients in the first month of life. The procedures in this patients group and the youngest one are in majority life-saving procedures. The youngest group of patients, it means patients below the first month of age, we are performing mostly the life-saving procedures due to the critical state of them. And the older ones, we are doing all spectrum of procedures that are widely accepted all over the world. And the oldest group of patients in this center, it means that the patients below 18 years of age, majority of procedures are the procedures related to closing of the shunts, extracardiac or intracardiac shunts, and also dilating of the coarctation of aorta or the dilation of the pulmonary arteries. In this group of patients, we have quite an experience with stenting of the coarctation of the aorta and different narrowings of aorta, such as middle aortic syndrome. And the group of patients, over 100 now, is a quite significant experience in the world, just relating to the one-center experience. The patients who are older than 18 years are under control of adult centers, and even if we recognize their problems due to organization reason, we are not doing these procedures in this cath lab.
We are in the biggest reference center for fetal cardiology in Poland. Ultrasound clinic of Warsaw Hospitals for Children, cooperating closely with Medical University of Warsaw. Yearly, we diagnose about 200 new fetal congenital heart defects and about 100 cases of arrhythmia and other functional changes and other organ defects. Majority of our fetal patients are from low-risk pregnancies, so very important part of our work is education for obstetricians, as they have to diagnose or suspect cardiac problem in fetuses during screening examination. As fetal heart defects are dynamic, we 2 years ago established interventional cardiac program for fetuses, and we performed 37 procedures for aortic stenosis, pulmonary stenosis, and restrictive interatrial septum. Majority of Polish mothers who know that their child is going to have heart defect decide to carry on pregnancy. So there is a big problem for neonatologists and pediatric cardiologists to cope with the very, very difficult heart defects. On the other hand, there are some children who had lethal disorders, coexistence with genetic syndromes or other organ defects, and parents would like to carry on pregnancy as well. So we established the perinatal palliative care program, which is very important for those families. Thanks to this, that we cooperate closely with Warsaw Hospice for Children, we have very good cooperation with psychologists. So fetal cardiology is not just giving the diagnosis, but as well the full consultation for the parents, medical consultation and psychological consultation. All those families have the chance to carry on the pregnancy and have the chance to have the very good care in the reference center for perinatology until the end of pregnancy and in the perinatal period. Majority of defects which are diagnosed prenatally are severe and critical heart defects, so it is very important to develop good perinatal program and to inform neonatologists and cardiologists which procedures would be necessary for those children. For those children who are lethally ill, they have the special program and they can unfortunately die in the neonatal units, or they can be taken home under the pediatric palliative care.
Welcome to Pediatric Electrophysiology Lab in Department of Pediatric Cardiology, University of Medical Sciences, Poznań, Poland. For many years our clinic has been specializing in diagnosis and treatment of cardiac arrhythmias in children. Based on this experience, we introduced invasive electrophysiology study and radio frequency ablation in children in 2007. 1 year later, we started with the cryoablation procedure, which significantly increased the safety of treatments in children with additional pathway found around the atrioventricular node, including mid-septal and anteroseptal locations. Since 2010, our laboratory has been equipped with a modern electroanatomic system and site NAVIX. This system has allowed us to carry out electrophysiology study and ablations procedure without exposing the patients to ionizing radiation or reduce the radiation during the procedure, which in children is of particular importance. Each year we perform approximately 100 ablations procedure in children in all types of supraventricular and ventricular arrhythmias. All treatments are carried out using the non-fluoroscopic electroanatomy system. To our particular satisfaction is the effective treatment of radiofrequency ablation in children after cardiosurgery of cardiac complex heart defects operated in Poland and abroad, including post-Fontan surgery. In our EP lab, each year we also perform 50 to 60 implantation of all types of single chamber and dual chamber cardiac pacemakers and cardioverter defibrillators.
I'd like to welcome you in the Department of Pediatric Cardiac Surgery in Gdańsk, Poland, what is actually the youngest and the newest department of Pediatric Cardiac Surgery in Poland. Our department was established in 2008 with the great help from Great Christmas Orchestra to Help Children, who was a donor of our specialistic equipment to perform all advanced procedures. Looking for our identity, we tried to establish a very big and very wide road program of hybrid procedures in Gdańsk, which are performed successfully in our department. Nowadays we perform all kinds of procedures in every age, including the youngest children in north part of Poland. We have just finished the next case, what is a 5-month-old baby with tetralogy of Fallot, who just came from operating theater just after the anatomic correction. From the very beginning of our activities in Gdańsk, we made successfully over 1,000 procedures so far. Hybrid procedures which are performed in Gdańsk are focused to combine pediatric cardiac surgery with pediatric cardiac interventions just to gain maximum benefit for the patient with minimal risk of potential complications. And the main goal of hybrid procedures in Gdańsk is to create the spirit of cooperation between cardiologists and cardiac surgeons in our department.
I'm one of the hundreds of Polish cardiologists and cardiac surgeons which today took this beautiful boat and starting to Amsterdam of the European Congress of Cardiology. We are celebrating 30 years anniversary, the biggest charity help which done for Polish kids with complex congenital malformation by Dutch society. That's great achievement, and you give us tremendous credit, and we did for the years develop very much cardiology, modern cardiology and cardiac surgery in Poland, but also we documented how much we help to another people in another country just to share this very special gift which you give for us 30 years ago. Thank you so much and welcome you on the board to celebrate and join with us.
This is a very good place to thank our Netherlands friends for the help that we received many years ago, and also to show the situation of congenital heart diseases and growing up in Poland these years.
And then we are just sailing here not only just to say thank you, our friends, but just to show off the really power of Polish modern cardiology and cardiovascular surgery.